Prednisone versus methylprednisolone. It's a mouthful and it's confusing. Most people think they are just different name for the same pill, but choosing the wrong one can change how you feel and how your body reacts to these medications. I'm going to take away the confusion with those long names and tell you exactly what sets them apart and how they help you. Hello, rheumatoid arthritis warrior. This is Dr. Ananta Subedi, your rheumatoid arthritis coach at the Rheum Doc, as well as a practicing rheumatologist here at Empower Arthritis and Rheumatology Center. Today, I'm going to tell you about two commonly used drugs in rheumatoid arthritis treatment, prednisone and methylprednisolone, which are typically used in flare management. Before I go further, please like and subscribe to our videos. Also, put some comments so that we can understand what you need, what are your current struggle with managing with rheumatoid arthritis. Also, accept our gifts. There are two gifts we have created just for you. The number one is the free copy of the Holistic Rheumatoid Arthritis Guidebook and a recipe of a smoothie that you can create every morning. And if you do that every day, you may not need to use these corticosteroids. Now, let me quickly recap from our prior video where we talk about corticosteroids. As we have discussed, corticosteroids are powerful tools. They are powerful anti-inflammatory that reduce severe pain and severe swelling associated with rheumatoid arthritis flare. And we can also use them as a bridge therapy when you are initially diagnosed with RA and you are waiting for the long-term medication to kick in. So there are two main reasons we use corticosteroids: flare management and as a bridge therapy. And they suppress your immune system that is overactive. And it also helps prevent the attack into your joints and your other body parts. So they typically help control overactive immune system. And the good thing about them is they work fast. They work within hours to days so that you can feel better faster till those disease-modifying anti-rheumatic drugs or DMARD, which will take long time to work. So they are fast-acting medications. And there are many different types of corticosteroids. One of them, the most common one being the prednisone, which is an oral pill that you take by mouth. When you take the prednisone, your body changes it to different forms. In particular, the liver convert the prednisone into prednisolone. And this is the most active ingredient of the prednisone. And prednisone is commonly used in many chronic inflammatory conditions, such as rheumatoid arthritis. And one pro tip, if you take prednisone, take it with meals so that it can minimize the risk of gastric irritations. Now, the other commonly used corticosteroid is methylprednisolone, which can be taken either IV or even in the injection form. And you might also see this in your Medrol dose pack, which is commonly found in the US as a tapering dose steroid, which your primary doctor or your rheumatologist might prescribe. So there are different routes. As we discussed, it can be given IV or it can be given as an injection into your joint. So methylprednisolone is the one that is given IV or in the form of injection. Prednisolone is already an active form compared to prednisone, which need to be converted into an active form. That's why it works fast. And particularly for those people who have liver-related problem, this might be a better preparation to help your arthritis better and faster. That's why we typically use methylprednisolone in the acute situation, such as in the ER. If you go to the emergency room, they might give you this form of medication so that it can work faster. It is also used when you have severe flares, which means you have many joints that are inflamed and you are in severe pain, and typically given in the emergency room setting or in the hospital setting. When we compare the prednisone versus methylprednisolone, there is a subtle differences. The methylprednisolone is a more potent compared to prednisone. If you see the table, it's 1.25 times stronger than prednisone. And the prednisone is converted to an active form in your liver, as we discussed earlier. But the methylprednisolone is already in the active form, so it does not need to be changed by your liver. Prednisone is typically given by mouth in the pill form, and the methylprednisolone could be pill, like Medrol dose pack, it could be IV, or it could be injection directly into your joints. The half-life means how long the medication stays in your body. Overall, the half-life of the medication is quite similar between prednisone and methylprednisolone. That means it stays in your body for a similar duration of time. The other common question you might ask is, when does your doctor choose which form of the corticosteroids? So prednisone is typically used more for longer-term oral tapering dose, typically after a flare. Occasionally, some of your RA warriors might need a lower dose of maintenance treatment of prednisone. In particular, when you are not doing well despite using a lot of other medication like disease-modifying anti-rheumatic drugs or even biologics. So some of our RA warriors might need a lower dose long-term prednisone to manage a good quality of life. On the other hand, methylprednisolone is typically used in more severe and acute flares. If you go to the ER, your ER doctor might give you the IV form of methylprednisolone. And occasionally, your rheumatologist might also inject methylprednisolone into your joint if you have one or two joints that are flaring. As with any of the corticosteroids, both prednisone and prednisolone share the common side effects, which includes weight gain, sleep-related problems, increased infection risk, mood changes, weakening of your bone, even causing osteoporosis, and the risk of diabetes. That's why we choose the prednisone or prednisolone just for short duration of time and then lowest dose possible. That's the rule of the game. Always ask your rheumatologist, do you really need the prednisone or not? And always ask them, how long do you expect to be on the prednisone? And ask them to do shorter duration, the lowest strength of the corticosteroid. And that can help you minimize these type of side effects. As you are listening to this video, I hope you are learning from these important information and it will help you make your informed decision. If you like this video, give us a thumbs up and also tell us what type of video do you want in the comment below. And we'll be coming up with those useful health information related with rheumatoid arthritis. And this help you make your informed choices when it comes to taking these medications. Because these medications are powerful. They are essential to help you feel better faster, but we need to be very careful how we use it. And we talk about two types of steroid today. That includes the prednisone, the pill form, and the methylprednisolone, which could be pill, injection, or into the joint. And always work closely with your rheumatologist and your primary care doctor so that you can use the right dose for the right duration of time when you are having a flare or as a bridge therapy. By listening to this video, I hope you learn more about steroid and you can now better take control of your rheumatoid arthritis in partnership with your rheumatologist and your primary care doctor. If you like this video, please give us a thumbs up and I'll come back next time with other videos similar to this. I'll see you next time. Bye-bye.